Following Jada, who opened the conference, is a tough act to follow, given that I'm speaking on the same subject. So Jada, if you're around at lunch, please give me notes. Tell me how I do. Sir John was saying that the NHS is beginning to buckle under the weight of our sickly population. And by far the greatest cause of avoidable ill health in this country is poor diet, much bigger than alcohol or smoking. By 2035, it's estimated that type 2 diabetes, just one condition caused by diet, is going to cost the NHS more to treat than all forms of cancer do today. Diet-related disease is a double threat to the nation's finances. It imposes huge costs on the health service while simultaneously reducing the productivity of the workforce. Sick people work less and pay less tax, and that says nothing about the misery to sufferers, their families and their carers, and the years lost to spending time with friends and children and grandchildren. A review published last week by the Institute for Fiscal Studies estimated that obesity in adults currently costs the economy £65 billion every year, 3% of GDP, in healthcare costs, lost economic productivity, social care, and cost to the individuals concerned. The IFS admits that this is probably a significant underestimate. It excludes the costs of bad diet in children, in people who are overweight but not obese, and the growing number of people who have diet-related conditions but who are not overweight. In America, for example, 1 in 4 people of normal weight, the so-called skinny fat, have prediabetes. A diet of cheap junk food also has the peculiar quality that it can make you simultaneously overweight and undernourished. This is a big enough problem to be visible at an international level. Our 5-year-olds are on average shorter and heavier than nearly all their peers in high-income countries. And these costs are likely to grow, and they're likely to grow a lot. Only 1% of today's 50-year-olds were obese when they were 10. Today, a quarter of 10-year-olds are obese. And we know that the more you weigh as a child, the more you are likely to weigh as an adult. And also, the earlier excess weight develops, the earlier the related diseases kick in. What does this look like if we play it forward? The NHS will suck all the money out of the other public services because we can't let it fail, and at the same time, economic growth and tax revenue will stagnate. We will end up both a sick and impoverished nation, and no amount of technological transformation, no amount of efficiency in the health service will be able to cope with the number of sick bodies that we're throwing at it. Whichever party is in power in 10 years' time will be crippled by this double threat if we don't act. Politicians have known this for a while, and they have acted, sort of. Between 1992 and 2020, UK governments published 14 strategies to improve our diet, containing 689 different policies. But all of these schemes failed. Why? Because with a few small exceptions, they relied on voluntary action by companies or individuals trying to encourage people to exercise willpower and make healthy choices without acknowledging how the food system we live in shapes our behavior. Think about it this way. In 1950, less than 1% of the UK population was obese. Today, that figure stands at 28%. Do you really believe that in the intervening years, the British public have suffered a massive collapse of willpower? Of course not. Human nature hasn't changed. Our environment, our food environment has. Biologically, we are still hunter-gatherers. If you have to search for everything you eat, it makes sense to look for things that will give you the biggest calorific return on the energy you expend. Honey, for example, contains 6 times more energy than the equivalent weight of berries. When we eat honey, our taste buds have evolved to respond with intense pleasure, a natural feedback mechanism to reward us for finding such a bountiful source of energy. The same is true of, say, chocolate ice cream and broccoli. There are other qualities that can turbocharge our appetites. Food that contains sugar to fat in a ratio of 2:1, for example, the same ratio as breast milk. These instinctive preferences are not lost on the food industry. Because we like certain kinds of foods, companies invest more in developing and marketing them. This means we eat more of them, which leads to more investment, which makes us eat more, they invest more, we eat more, and we get sick. It's a classic escalating feedback loop, a vicious cycle. In the National Food Strategy, we called it the junk food cycle. As food companies have competed for share of our stomachs, they've also introduced entirely new foods into our diet, specifically designed to hack into our ancient appetites. These ultra-processed foods, when not just calorie-dense, but soft, low in insoluble fiber, and containing ratios of salt, sugar, carbohydrates, and fat that you don't typically find in home-cooked foods, have been shown to be particularly effective at making us eat too much. It's hard to exaggerate the extent to which the junk food cycle has come to dominate the modern diet. In the UK, 57% of the food we eat is ultra-processed. The entire fresh fruit and veg market is worth a measly £2.2 billion per year, whereas confectionery alone, one small section of the junk food market, is worth almost £4 billion. Over 80% of the products sold by the 18 largest food companies in the UK are deemed by the World Health Organization to be too unhealthy to market to children. It is a bizarre fact, but commercially unsurprising, that in the UK you can buy 28 different kinds of Kit Kat. They are simply easier to sell than kale. And importantly, it isn't just consumers who are stuck in this junk food cycle, it's the food industry itself. If one company stops developing and selling unhealthy foods, their competitors will simply do it for them and hoover up the products, the profits. They're caught in a junk food arms race, and it is too commercially dangerous for any of them to disarm unilaterally. Unless the government intervenes to stop them, each company will keep dreaming up ever more shameless ways to fill our shopping baskets with cheap, profitable, sugary junk. Last month, for example, Nestlé released what it described as a tasty and nutritious new breakfast cereal. The 29th way in which you can now enjoy Kit Kats. To be fair to Nestlé, they did put an asterisk on nutritious, and if you went down to the bottom of their website, you could see it meant that they'd added vitamin B12. And also, to be fair to Nestlé, they're not doing anything that their rivals aren't. This is what the junk food cycle looks like. Huge food companies slugging it out at children's eye height on the supermarket shelf and making us sick in the process. Individual willpower alone is not enough to break the junk food cycle. We need government intervention. One obvious move would be to restrict advertising and promotions of junk food to children. This is something the government promised to do 5 years ago, but under pressure from corporate lobbyists and the Libertarian Brigade, it has repeatedly kicked the legislation into the long grass. In the National Food Strategy, we also recommended a sugar and salt reformulation tax. This would only apply to ingredients used in food manufacturing, creating a natural incentive for companies to reformulate their products. Most companies would rather reformulate than raise their prices. Our modelling suggested that this tax would trim between 15 and 38 calories off the average daily intake. That might not sound like much, but it would on average only take a reduction of 25 calories per person per day in this country to stop weight gain altogether at a national level. This tax would also raise £3 billion, which could be spent on schemes that support the diets of those living in poverty, such as free school meals to all those on universal credit, social prescribing to get more fruit and veg into the hands of those struggling to eat well, and improving cookery education so that more people have the skills to cook from scratch. The Tony Blair Institute has just published a report informed by the National Food Strategy which sets out many other creative policy solutions. And yet, politicians dither, afraid to be seen as interfering or judgmental. The term nanny state was coined in this country in the 60s by a ruling class of men raised by nannies and with conflicted feelings about them. It is used as an insult and a warning. We mustn't let nanny boss us about. But in the case of diet-related disease, the libertarian argument is exhausted. The financial feedback loops in the system massively favor one kind of business model, using cheap ingredients to make cheap products that hijack our evolutionary cravings. And so one kind of food has come to dominate the consumer landscape: sugary, fatty, processed convenience foods. You aren't going to be able to change that without legislation, however much you wish you could. The electorate get it. Poll after poll shows that citizens want more government intervention. They hate seeing their children bombarded with advertising for junk food. Even the food companies, who in the past have insisted that they can improve voluntarily, are beginning to admit that they need government legislation to level the playing field for them. Last month, James Meyer, president of Danone UK and Ireland, publicly called for a sugar and salt reformulation tax. It was probably a bold move, given that his former CEO, Emmanuel Faber, was fired by his activist board in 2021 for being too keen on sustainability and not keen enough on profit. So we wish James Meyer well. A nation's asset, said Winston Churchill, is the health of its population. Our broken food system is destroying that asset, and only by fixing it can we build a healthy and prosperous future for Britain. Thank you.